So how do we deal with this disorder day to day when so much about them is a mystery? Dr. Jennifer Caudle is a board-certified family physician and assistant professor at Rowan University School of Osteopathic Medicine. Dr. Caudle is a spokesperson for the American Osteopathic Association and is the creator of the Physician's Blog. She also presents workshops and health and wellness. So please welcome Dr. Jennifer Caudle. So what are some of the key warning signs that we should be looking for people over 50?
Sure. That's a great question. We've been talking about autoimmune conditions, and they can be so vast and so wide-ranging. One of the hallmark symptoms of autoimmune conditions is inflammation. This inflammation can happen pretty much anywhere in the body. It really depends on the condition that the patient has. And sometimes people have symptoms in the beginning, such as low-grade fever or muscle aches or fatigue, things like that. But the truth be told is sometimes the symptoms people have are really hard to pick up as being autoimmune in nature. The symptoms really depend on the condition. So, one of the things I say to my patients is this: it's really important to know your body, to know what your normal is, to know how you are, how you feel, how you operate, so that when something happens that's not quite right, you're not feeling yourself, you know to bring it up with your physician. Because in autoimmune conditions in particular, sometimes making the diagnosis can be tricky because the symptoms can often seem like other conditions altogether.
So really, you have to rely on what your patient tells you.
Absolutely. I'm a family doctor, and it's one of the things, I sort of like being the quarterback, the person that coordinates care. And oftentimes, one of the reasons why I went into family medicine is because I love being the first person that people see. Someone will come to me and say, Doc, I've been feeling tired, and my joints are a little achy, and they're kind of swollen, and I don't know what's going on. And we have to start right from there. So it's really important, I say, when patients are experiencing symptoms that may not be right, I always tell my patients, if you're concerned or if you're worried about your symptoms, then I might be too. So write them down and bring them into your family doctor.
And I'm sure there are a lot of patients who, just don't want to, deal with it. They just go, oh, it's just an ache, it's just a pain.
Right. Or they don't think
and then
it's
they
important.
wait too long, right?
Right. Or, they don't want to deal with it, number one, because maybe there's some fear. I've had patients say, I was really worried, and so I didn't want to come in. Or they say, I didn't think it was anything at all. I just thought I was just working too much, or I thought I was just, exercising too hard. So that's when you really want to seek out some medical consultation and just get an opinion.
So you're kind of like a detective.
I'm like a detective, yes, I am.
So what is the cure? Are there cures? Are there treatments? What can be done?
Well, there are treatments, and there are many different treatments that we have for autoimmune conditions. I think this is one of the most important things to talk about is, when I see patients in my office and maybe we've made the suggestion of an autoimmune disease diagnosis, or I've referred them to the rheumatologist and neurologist, and they've been diagnosed. I think one of the fears that I've picked up in a lot of my patients is really just that. It's a fear. They say, what's going to happen to me? What's my life going to be like? Am I going to be able to live a full life? And the answer is, in many cases, yes. I mean, we have great treatments, and they really affect different aspects of the conditions. So, for example, there's treatments that deal with the immune system. Autoimmune diseases are conditions that where the body is attacking itself. So there's medicines that attack or deal with the immune system. There's some medications that help deal with the symptoms, and other medications that replace substances that the body is just not making or doesn't have enough of.
So if you're diagnosed with these diseases earlier in life, how will it affect you later in life?
So it depends, again, on the type of condition that a person has, the severity of the symptoms, and just sort of the severity of the illness in general. So it's really not one size fits all when we talk about autoimmune conditions. It really is very patient-specific and disease-specific. So that's something to keep in mind. But it's important to be optimistic. And so many people can live a very full life with autoimmune conditions with the right treatment plan, and being under the care of not only a primary care doctor, but specialists as well. And that's very important.
So how do we talk to our children and our grandchildren about this, and how can, if it's genetic, how do we help them, prevent this disease from happening to them or educating them about it?
Yes, so my solution to that is to talk. A lot of families don't give information to one another. A lot of families don't talk about what the grandparents had or the great aunts and uncles and stuff had. This is so important, especially in autoimmune conditions as well as others. As families, talk. You write down what conditions your parents and your aunts and uncles and your grandparents had, and keep that list and make sure your children know, because as physicians, one of the things we rely on, first of all, a lot of what our diagnosis and our ability to make diagnoses and recommendations depends on the information we give our patients. And when our patients can tell us a lot about what's going on in their family, especially since autoimmune conditions, a lot of them have some genetic connection or link, this makes making a diagnosis and getting patients help a lot easier. So keep a family history, take notes, share that with your family. So important.
What are some of the resources available for someone who has an autoimmune disorder? You know, how do you help them live with it? How do you live?
That's a great question. I think that one of a really important thing is to have a support system. I talked a little bit earlier about the fears. Sometimes that can happen. A lot of my patients, when they're diagnosed with whether it's rheumatoid arthritis or psoriatic arthritis or lupus, depression or anxiety sometimes can set in. Worries, fears, and just a lot of questions. So first of all, have a support system, and hopefully your doctor is a part of that. And something I always say about doctors is find one that you like. Yeah. Find a doctor you can talk to that will listen to your questions, that will let you cry and scream and shout and whatever you have to do in the office. Start with those two things.
But what do you do? I know a lot of people who say to me, oh, I've got lupus, I've got fibromyalgia. And to be perfectly honest, even I have sometimes looked at them and just thought, no, you just are being a hypochondriac. And I mean, like we saw in this, it's not fair. It's not fair. It's not visible that you are handicapped.
Right.
And how do you deal with that? How do you let people realize that this is something very real and it's just invisible, but it's really a tough thing for you to deal with?
There really can be a stigma associated, especially with a lot of the symptoms that autoimmune conditions have. A lot of the symptoms that go along with autoimmunity can go along with other conditions like fibromyalgia, etc. And yes, sometimes there can be a stigma. And I've had patients say, Doc, is it all in my head? Am I crazy? And the answer is, not necessarily. You want to go to your doctor, write down your symptoms, keep a symptom log, and talk openly and honestly with your physicians. And you're right, just because we can't necessarily always see the symptoms on the outside does not mean there's not something very real going on the inside. So I think that understanding is so important to have.
So you need to educate yourself. Once you get a diagnosis, you need to educate yourself, learn as much as you can about your very specific diagnosis.
Absolutely.
And then listen to your body and keep a history. Well, considering the wide range of autoimmune disorders, we expect there to be a lot of questions on this subject. So we thought we'd open it up to some additional questions. Would you like to take one?
Sure.
Do we have one? Yes.
I was diagnosed in 2011 with myasthenia gravis. It's a rare neuromuscular disorder. What is the most challenging situation for someone diagnosed with myasthenia gravis?
That's a great question. So myasthenia gravis, as you mentioned, is an autoimmune condition. And often what happens with patients, as I'm sure you're very well versed in this, is that the muscles get tired, usually over the course of the day, especially with repetitive motions. And it can happen to any muscle in the body, not just the limbs and the arms and the legs, but even things like the eyelids and the muscles that we use to chew. So it can be very difficult. It can be very debilitating. I think for patients, there's a few things that can be very hard. Of course, the symptoms. It's tough to deal with. It's tough when muscles fatigue, and especially towards the end of the day and after repetitive motions, that gets very hard. But I think something else I brought up, which is the emotional aspect. I think all of these conditions and so many others, emotionally, sometimes it's just hard to cope with, and to understand the condition that you have, and to sort of deal with the ups and downs that sometimes naturally comes with these. So as a physician, that's something I've seen with my patients that can be particularly difficult to deal with.
Does a support group help?
I think they can be very, very helpful. I really do. Support groups can be helpful. Sometimes it can just be a pastor or a clergy person at church. Sometimes it can be a group of girlfriends who you can run interventions on if you need to and sit around and chat. But it's got to be sort of a trusted group of people or person that helps you feel whole again, and helps you get that feeling of normalcy that sometimes I think is hard to feel when you're facing autoimmune conditions.
Thank you, Dr. Caudle, for coming on the show and helping us start the conversation, and for shedding some light on the complex warning signs of those mysterious illnesses.